Well, as a scientist, really all you have are your firsts. The first to discover something. And so that's a very strong driving force, always wanting to know what's the next thing? What is the next answer? I always want to look at a problem for what can we do with it? Can you use it to do something to help other people, other animals, the planet? And that really ends up being a driving focus for my research. So this journey started about 4.5 years ago. It was really an idea drawn on a bar napkin that I convinced a student to take on.
Joe was a younger faculty member at the time. He'd only been at ASU for the previous year, so he was just building his lab. He did have a nice little startup package, so we knew that we would be funded and we could get the project off the ground.
We've designed a new technology, and with any new technology that's never been done before, you have to take chances and you have to fail. But in each failure, we've learned something and we've gained the ability to move forward and do something spectacular. So the promise of this technology is to give truly personalized medicine for people with cancer, to say these are the mutations, so therefore these are the therapies you need. When you show up in the clinic with a palpable cancer, that's about 1 billion cells. So it started from 1 cell, became 1 billion cells. If you calculate how long that took, it's between 20 and 30 years. So in that time, the cancer has been very successful in diversifying. In order to develop an effective therapy for that whole group of different kinds of cells, you have to measure what is the diversity. Our technology allows you to get a snapshot of all the mutations. And that allows you to design treatments that will take care of cells that are resistant to chemotherapy.
I first got to know Joe Blattman in the summer of last year. He'd already decided at that point to take his breakthrough research and form a company around it. Our business concept for Gemneo is fairly straightforward. It centers on 2 strategic pillars. The first is the innovative science that Joe and his collaborators have developed at Biodesign. We intend to bring that to market in an open and collaborative manner, which is the second pillar. And the idea is to put this innovative technology in the hands of multiple pharma and academic researchers who can then use it to develop companion diagnostics and therapies to advance the cause of personalized medicine.
When I was young, I had a cousin who was the same age as I was, who died of leukemia. Cancer is not something that happens to somebody else. It can happen to those that are very close to you. And so that always reminds me, cancer is not that far away.
So Joe's science and our lab's work in general is extremely important to science, especially the field of immunology. We're one of the few remaining labs that actually focus on fundamental immunology. So ASU's been leading the nation in innovation over the last few years, largely in part due to research and the collaborative efforts that ASU instills in its researchers.
Biodesign has a fantastic track record of not only doing great science, but bringing those scientific discoveries to the marketplace in an accelerated fashion through the spawning of a dozen or more companies in the last 10 or 12 years.
The thing that ASU does the best is not say no. It's a climate allowing you to come up with incredibly diverse ideas and pursue those. There's no other place in the world that we could have done this project except at ASU.